So having a shisha is basically having a smoking session for about an hour, or 30 minutes to an hour, and that affects what you breathe in, what you breathe out. So shisha is tobacco, it's smoked tobacco. Tobacco contains over 4,000 chemicals. 60 of them are known to be causing cancer, so carcinogenic. So an hour shisha session is like smoking 100 cigarettes, basically. So it contains tar as well, so that blocks the lungs. It affects the heart, the cardiovascular system, increases blood pressure. So if you're doing this at a young age and you're doing it quite regularly, that's going to affect you when you're around 50 years old. It's going to affect your movements. When you wake up, you might have a bit of vertigo. You might be on blood pressure tablets when you're that age. So we really recommend people to cut down on shisha or stop completely. It's not a good habit.
Yeah. I mean, I know another one that is really popular is chewing tobacco.
Okay, yeah.
Among the Muslim community.
Yeah.
What kind of effect does that have on oral hygiene?
So that's the worst type you can have. So because chewing tobacco, betel quid or palm chewing, you're directly putting the tobacco onto your gums, onto the tissues of your mouth, and that has a direct cancer effect basically. So if you look at, say, the population of India, look at the cancers. So mouth cancers contribute to, say, 30% of overall cancers. In the UK, it's only like 3% of mouth cancers. So really recommend not to do that. So it also increases the risk of gum disease by 3 times.
Can you recommend any way for anyone who's struggling to find a dentist for how they can get themselves signed up?
Of course. So a lot of dentists now, unfortunately, have got quotas from the NHS. I'll start with positive. Okay. Of course. So you can just phone them up. Phone as many as you can. So my sister, she phoned 5 dental practices. She's found one about 20 minutes away in the car. Dentists, they've got quotas, and if they go over the quota, they're not going to get paid for it. So one way of looking at it, you might think, oh my God, how come dentists not getting paid? Aren't they getting paid enough? And the short answer is, well, dental practices, it's a business. The NHS don't own that practice. It's a business person, man or woman, getting a practice, buying all the equipment, buying all the staff, and treating patients. So they've got a quota, and if they meet the quota, they get paid for it, but they don't get paid for any more. So if they treat so many patients and they're exceeding the quota, how are they going to pay the extra hours for dental staff, the extra materials? They can't. And it's not sustainable business. So if you can't get an NHS dentist, recommend seeing someone privately. So privately, you might be paying £60 for a checkup. NHS-wise, that might be about £25. It is a bit more, but you can't really put a price on your health.
And do a lot of dentists constantly have open spaces for private, or do they become quite rushed as well?
So they'll often have places for private patients. The benefit of going privately as well is instead of a 10-minute checkup NHS, you'll have maybe 20 minutes, so you have double the time. You feel more comfortable to take time with you. They'll explain risks and benefits much more with you, and they'll give you a printout treatment plan as well.
So what can you do from today to improve your oral health for the better?
Absolutely. So number 1 is remembering brushing is a sunnah. So don't think you're just doing it because your dentist told you it's a sunnah. You'll get rewarded by Allah because the Prophet Muhammad, peace be upon him, did it. Number 2, brush twice a day with a normal toothbrush. So fluoride toothpaste, 2 minutes, take your time, spit out the toothpaste, don't rinse out. Third point is ensure when you're brushing your teeth, brush the gums as well, because you don't want gum disease. Number 4 is don't use mouthwash at the same time because you're washing away all the toothpaste. Toothpaste is the most important thing, contains all that fluoride to protect your teeth. So number 6 is cut down on fizzy drinks. So although they may not contain sugar, they wear down your teeth. So imagine acid rain on a tree or on a limestone building, it wears it down. That's the same thing on your teeth as well. Try and cut down on the frequency of sugar that you have. So if you're having sugar like 5-10 times a day, you're increasing the risk of tooth decay. You're giving it time for your bugs in your mouth to eat as much sugar, pour out acid, and rot your teeth. So try and have it with a meal if you can, and increase the amount of fruit and veg. So fruit and veg is always very good. It contains lots of fibre. It helps kill the bacteria as well. and helps things like vitamin C. So vitamin C helps reduce things like scurvy, gum problems. Yeah.
Cool.
Don't smoke as well. Last one. So any listeners out there, see your local GP or the smoking helpline.
Sweet, sounds good. Thank you for your time.
Oh,
thank you for all of your advice.
Thank you very much.
I'm sure a lot of Muslim brothers and sisters will be able to benefit from it.
Yeah, well, thank you.
And may Allah reward us all for all of our hard work and effort.
Ameen. Yes, thank you very much.